thank you everybody for joining us today for the first of two financial assistance webinars that we're going to be putting on in conjunction with Accessia Health, Patient Advocate Foundation, and Accessia Health. So with that, I'm going to pass it over to our first presenter, Erin Bradshaw, to kick us off.
Right. Well, thank you for joining us today. I know we have three of us. They're going to share a little bit more about each of our organizations and some of the tools that we have, resources and services. My goal today is to provide some overview of the services that we offer that can help individuals that are navigating the space of financial hardships, whether it's through direct services, financial aid, or a resource or tool that can be of help to patients, families, professionals, and caregivers alike. My name is Erin Bradshaw. I am the EVP for the Advancement of Patient Services and Navigation, and I've actually been with Patient Advocate Foundation for 26 years, and my background is within the case management side and operations, so really passionate about making sure people know about valuable assets and resources to complement the clinical navigation that people are undergoing as they progress through disease. So I thought it'd be important to start with the why. Patient Advocate Foundation is a national 501c3 nonprofit charity. We were founded in 1996. It all started with a patient. That was prior to the founding of our organization. But we know firsthand it's hard enough for us to have any type of life-altering or chronic disease. And then when you couple it with the ability to afford health insurance, recommended treatments, and medication, and then all of those essential costs and necessities like food, transportation, and many people facing time away from work, it really becomes extremely emotionally overwhelming as well as financially challenging. So Patient Advocate Foundation has been doing work for 30 years to make sure patients that are going through these scenarios have the support systems through our work here to take away some of those burdens and hopefully address a lot of the social determinants or an equitable access that they might have. So as you can see, we've served lots of people over the years. Our level of engagement is truly through direct financial aid and or case management. And so what I was going to do is just share each one of the programs very high level and how you can connect to them so that you could get a better core understanding. So as I shared, we were founded in 1996. And the reason why we were founded was based on the navigational aspects and insurance and assurance, the access to insurance products and, maintaining a household. And even though some of those things have evolved and we've had some different sections that have passed or different rules and regulations, there are still lots of challenges around, being able to navigate the day-to-day practical aspect of things, as well as, maintaining the financial household. So the purpose of our case management team is to provide critical assistance and help patients with life-altering conditions that really are impacting their ability to healthcare access. Maybe they're moving from an able body to a disabled body and have to maneuver those scenarios, whether it's an employer-based or a Social Security application. We also address insurance benefits, so lack of, the use of, or being prescribed something that maybe is not being covered, that needs some support in helping overcome those barriers. In addition, medical debt is always going to be an area of need, as well as the day-to-day cost of living support programs. So what we're doing in those cases is, while case management doesn't have direct financial assistance, it's really an alternative support system around financial navigation, because each one of these areas has a critical impact to the financial security of a person who is in the midst of, whether it's a newly diagnosed, a screening of, or maybe a continuation of care. And any of these elements, without proper approval or access, could immediately turn someone into a situation where they may not be able to pursue treatment and or find themselves in a situation where they might be not able to maintain their household. So for context, last year in 2023, we served just under 17,000 people with 958 different diagnoses, which half of them actually represented rare disease, which is not surprising because we know that there's many rare disease and the support systems and treatment and resources might be narrowed. The patients that come to us represent all of us. So it's all states, all ethnicities, all income levels and insurance statuses. And we share the inability to obtain the necessary medical care and afford the medical costs and everyday expenses. Just to give you a brief overview, the services are telephonic. On average, it requires multiple contacts and engagement between patients and stakeholders through our case manager. Their first interaction would be a patient intake, where our intake counselors ensure alignment of the scope of our service and capture details such as demographic, insurance, diagnosis, treatment, and support you need. And then the case is assigned to one of our skilled case managers who is in contact with you within 48 business hours, and then works with you throughout the duration of how long ever that may be. On average, we see that our cases are about 20 business days and require about 27 different contacts per case, but that's so subjective to the areas of support. Whether we're doing a health insurance appeal, for instance, it might take some more time because we are simply based under what we're working with the insurer. Obviously, anything of urgent, we try to pursue those things much quicker. Upon your assignment, your case manager conducts a deeper needs assessment to help gather relevant details and then creates a plan of action to find the right path to help with resources for your unique situation. And then as the case manager works alongside of you, they're your collaborator and advocate in the areas of insurance navigation, disability, and financial complexities. Our goal is to take that burden away from you and allow you to focus on what you need to for getting better and eliminating some of those emotional impacts from these elements. So you'll see you can access our website, patientadvocate.org. I do have a QR code too. At the very end of this, you'll see I'll have one slide that has all of this information for you. So another area, we have direct financial assistance too. So as I shared at the very beginning, our foundation of the organization was based on the work of case management. But as we began to work cases and heard the stories of those that were coming to us, we started to see a shift of that cost burden and becoming a very devastating and rendering many patients unable to afford necessary care that they have. So when we started to see this 20 years ago, we went out to design and launch our copay relief program, which is there to help improve access and reduce the financial distress by eligible low-income patients, providing direct financial assistance for insurance premiums, copay, co-insurance, deductibles, and medications prescribed to treat and manage disease. And in many funds, we also help with the office visit of the day or any supportive medication necessary for treatment. So we operate under the compliance of our guidance provided by the Office of Inspector General while delivering best-in-class service with an emphasis on ease and access and high-quality patient services. So patients, providers, or pharmacies have a capability to apply and support patients through our online or telephonic support system. I offered, again, some eligibility criteria here, as well as access to our QR code, but for overall, it's 500% or less of our federal poverty level, and there's an adjusted COLI index, and they must meet the eligibility guidelines for each qualification. It's just from a quick overview, we did establish copay relief health equity funds. So we use the CDC Social Vulnerability Index and the CDC's incident data to identify 226 counties and across 36 states with the highest rate of social vulnerability and high rates of multiple chronic diseases. This allowed us to separate and provide funding for that population very strategically to allow access to populations that might not have the same safety net resources and allow individuals to have access to them based on their zip code of their home address. Eligibility and there's a search tool, all of those things are available on copays.org. We have another direct financial assistance program called the Financial Aid Fund. We move forward a few more years as we're talking to people, we start to see the shift in the need for the transportation, lodging, and all those expenses associated to getting to care. And over time, it has evolved into including the day cost of living, so rent, mortgage, utilities, and things like that. Our eligibility is 400% or less of federal poverty with a COLI index as well. And then the diagnosis must be tied in to the eligibility of the program. Again, it's intended for a small grant to provide low-income patients for non-medical costs. We served over 65,000 patients last year and gave out $152 million and launched 53 new financial aid programs. So we're very pleased to be able to continue this work and know that the need is there. So one of the areas that we don't really talk about, but it is a financial assistance program, is the Scholarship for Survivor program. So in 2000, we established this program in honor of individuals that were impacted by their diagnosis. And we started to hear from families that had experienced this. So they were not able to set aside college funding for their children. The cost of their treatment really hindered this ability. And so we offer an opportunity for students to apply for one of 3 different programs. We are based out of Virginia, so we do have a Virginia resident undergraduate, but in addition, a national and a graduate pursuing a master's degree or higher, which for candidates, they can apply. And the link is a little long here, but I'll just direct you to the patientadvocate.org website. If you look at Contact Us, that will drive you to a drop-down list that also has the scholarship survivors, but you can read the guidelines there. We've just reopened for this coming year, and so application deadlines for this would be March 7th of 2025. We have a very robust educational resource library. We house this information in, it's like a central hub for content. It equips patients, caregivers, and professionals around critical knowledge and resources. Consider these more like self-navigating tools. They come in various different contents, from audio, interactive training modules, multimedia resources, full-length publications, and tip sheets with various topics like disability, medical debt, health insurance. We have open enrollment coming up soon. And so that's a pretty, is starting to become a popular topic to get familiarized with. Our number one utilized resource is our National Financial Resource Directory. And this is a tool that you can use, which is basically a searchable database based on national, state, and local financial assistance programs that can help with medical and non-medical expenses. It was recently rebuilt, and we launched a new tool in May with some enhanced features. And the tutorial to learn how to use the tool is actually in this QR code or tiny link here, or you can visit our patientadvocate.org website. It's really a nice feature, so you can narrow down against specific topics, and there are vetted assets that can link you directly to a resource that you can navigate that's further and see if it's a value. You can also extract the resources, select the ones that you're interested, or keep them all and email them to yourself or someone else that you might be helping. So as I shared, we really do understand the financial impact of rare disease and their families and how profound and multifaceted it can be. We want to be here to be of support, and we hope that the resources that we offer really can resonate and provide aid to those that need us. It's really our goal to make sure that not only do we provide one-on-one support or direct financial assistance where we can, but also continue to provide education and complementary wraparound resources around the financial, administrative, and logistical aspects of navigating disease. So I will pause for a minute just so that you might be able to capture that, but everything is actually accessible from patientadvocate.org, and copays.org is as well, but that is its own landing page. So if you would like to navigate towards those.
Awesome. Thank you so much, Erin. And we will have opportunity for questions at the end. So if you have something that you want to ask Erin, we can address that when we get to that section at the end. So now I'm going to pass it over to Jennifer Noonan from Accessia Health.
That work? Awesome. All right. Well, thanks so much for having me. And that was a great presentation. I learned something new every time I have an opportunity to hear one of the other organizations that are supporting individuals talk. I learn about a new useful tool. So thanks for that, Erin. My name is Jennifer Noonan, and I work with Accessia Health. I'm a nurse by trade and training, and worked for about 25 years in direct patient care capacities, and never knew that there was financial assistance available for individuals that might struggle. And so that's kind of my first soapbox that I get on when I have an opportunity to share about different opportunities that are out there for individuals that are struggling to pay for the very expensive landscape of healthcare these days. So at Accessia Health, we are a nonprofit financial assistance organization, but we do provide a lot more than just financial assistance. So just wanted to provide kind of a quick overview of what those things are. We are really focused on improving access across the entire continuum if we are able. We recognize that sometimes the length of time it takes for someone to even get a diagnosis can be very long and hard. So we continue to work also at making the processes easy as we can, so that we're not adding burdens. We've restructured some of our programming over the past year in order to be more inclusive of what an individual might need for their own personalized healthcare. So we know some folks might have a really good coverage through their employer or maybe through their Medicare, and they have a set amount that they spend in premiums that isn't all that much, but they can't afford their medications. And alternatively, we have individuals who might be able to afford most of their copay, but without a really costly premium to have a supplemental program, they may not be able to afford their medicines at all. And so we've changed our support a little bit to be more flexible for individuals to be able to choose whether they need their grant dollars to be spent towards premiums or more towards other medical expenses like copays for medications or doctor's visits for their specialists. So when we talk about support, again, we want to look at what is the entire picture for an individual that's dealing with a chronic or rare life-limiting health condition. So we know about the costs that we see upfront, such as medications or bills when you walk into the doctor's office or laboratory work. But one of the things that we also help individuals with is legal services or needing help with their fight, if you will, for obtaining their Social Security disability benefits if they have a condition that impacts their ability to work. We have a program called Access that will, for free, help people with certain diagnoses be able to move forward with that. We have a very small team, but they get in a plane and fly across the country and join folks in court cases. So that's been really valuable for some of our patients that have needed it. We also have several webinar series of education surrounding open enrollment. As we know, everyone could use a little more information about what that might look like year to year, including myself. So that's one of the other just say support services that we offer along with financial support. As Erin mentioned, talking about case management, we too have some case management specialists that will help individuals to agnostically make choices about what different types of healthcare options there might be available to them, especially as it might relate to a new treatment that someone might be undergoing, or help with understanding and navigating what kinds of coverage someone might need over someone with a different type of health condition with the coming up year. So we talked already about our legal assistance, our different resources that we have available on our resources page at accessiahealth.org. You'll see some information about all of those there. We like to provide everyone with all of the resources available. We do have quite a large selection of programs for individuals to choose from, but sometimes they're waitlisted. Sometimes the funding might not be open for applications at that time, and we want to make sure that individuals have an opportunity to explore all of the different financial resources that are out there and available. And I'm just going to pass this along to James so he can help us understand more about his organization, and then we can get to any questions anyone might have.
Perfect, thank you. So just a little brief background. I am a pharmacist by trade. And while, in healthcare and in working in the pharmacies, I mean, it's so complex and it's so much information. But one of the things that I struggled with when I used to practice is that patients all the time would come to the counter and see the price of their medications and could not afford it, and literally would sit there at that moment and have to make a decision. Do I use this money that I have for my bills or my children, or to buy groceries, or pay for any number of things that are important, or do I spend this money on my medication? And oftentimes I would sit in that moment, and there's a very awkward moment because, especially as a healthcare professional, of course, I want to do everything that I can for a patient. But when it comes to a financial barrier, that was somewhat out of my control. The issue with that is the lack of education and awareness. I was not aware of patient assistance programs and charitable organizations. So I did not have that information, that knowledge to recommend to patients. So I think it is a great thing that we are all here representing our organizations and telling you all a little bit about us. So at the Penn Foundation, let me move this over. So a little bit about PAN. We are a national nonprofit organization. We help patients all over the United States and the U.S. territories. We were founded in 2004. Actually, this year marks our 20th year doing this great work. We have helped over 1.2 underinsured patients since 2004. We've given over $4.5 billion. And as of today, we now have more than 80 disease-specific funds that patients can enroll in. So the current need for charitable assistance is there's a big need. Like 47% of U.S. Adults say that it is somewhat or very hard being able to afford their healthcare costs. And 50% of the U.S. adults say they would be unable to pay for an unexpected $500 medical bill. This is something, especially in the market that we are in, with the inflation and everything is costing so much. It is much needed for charitable assistance organizations to help patients who need the financial assistance. So our national reach, again, I mentioned we service patients all over the U.S. and the U.S. territories. And on this slide, you'll see where we have in California, Texas, and Florida, that is where we service most of our patients, but we service all throughout the U.S. Patient reach in 2023, just a recap of last year. So we have provided over $325 million in copay assistance for patients enrolled in our funds into 2023. We have had over 84,000 grants issued. We've helped over 110,000 patients, and also increased our work with our alliance partners through our network. So the reason for charitable and the importance of charitable assistance organizations is, one major thing is the increased medication adherence. If a patient goes to is prescribed a medication for a rare disease, chronic disease, number of things, and they are not able to get their medications because of a financial barrier, you have decreased medication adherence and health outcomes. Over 50% of PAN patients reported skipping doses or not taking their medications prior to getting a grant. We've done research that after receiving our copay assistance, 17% of the PAN patients reported skipping the doses. That's from 50% down to 17%. And then there's a 33% decrease in skipping doses or not taking the medication as prescribed. So a little bit about our funds. So at the PAN Foundation, we offer 3 different type of funds, again, spanning over 80 plus disease funds around oncology, chronic diseases, and rare diseases. We offer assistance for copay, deductibles, and coinsurances. We have some funds that help patients with their insurance premiums and also transportation assistance. And one of the things I would like to highlight, yes, we speak on the copay costs being a barrier, but also insurance premiums are a barrier as well. And we look at the Inflation Reduction Act and the out-of-pocket cost is decreasing, but the message that is not being told is that premiums are going up. So the out-of-pocket costs for medications are going down, but also the health insurance premiums are going up. And at that cap, and I don't know if you all are aware, the IRA in 2025, January 1st, the maximum out-of-pocket cost for medications under Part D is $2,000 per patient. But when you have patients who are oncology patients or who have rare diseases and they're receiving medications that have to be given by infusion or given at hospital or health centers, those medications are billed under Part B. Part B is not included in that $2,000 cap. So for some patients, for Medicare patients, they will be paying more than $2,000 for their medications. And on top of that, insurance premiums are increasing. So on the slide here, we just have a list of our disease funds that we currently operate between chronic, rare, and oncology. And the ones with the asterisks are the disease funds that have a copay fund as well. And the way our funds work is a patient can enroll in a copay fund. They also can enroll in a premium fund. And then they could also receive, once a patient is enrolled in either one of those or both, then they are eligible to enroll in our transportation fund. So how to apply for a grant. So we try our best to make it so very easy. I don't know if any of you have had to deal with filling out medical forms or just navigating just information in regarding resources. It can be very taxing. It can be very discouraging, and it could be overwhelming for some people. So we created a way to streamline and make our application process as easy as possible. There are 4 ways patients can enroll, caregivers can enroll for patients, providers can enroll for patients, and also pharmacies can enroll for patients. Check to see if the fund is open and available. Verify the eligibility criteria for that fund. Gather all the information for the patient if the provider or pharmacy is doing it on behalf of the patient, and submit the application. And instantly, our application process is very quick and easy. A patient would know if they are approved for one of our grants within less than 10 minutes. As soon as they are approved, they are allotted the money that is for that particular grant, and immediately they can go and take the billing information to the pharmacy and receive their copay assistance for their medication. So ways to get involved and stay connected. One of the things that we have done here at the PAN Foundation, while for so long we mainly, our main pillar was around financial assistance and copay, but we have branched and broadened our reach into like education. We do a lot of advocacy work around Medicare reforms and the IRA. I encourage you to please look on our web pages. It's panfoundation.org/reforms. Actually, we do an annual Medicare reform and information about PAN webinar. We do education around different disease states, and also doing community engagement. We realize that health equity is very important in our organization. And with that being important, we have to get on the ground and do the work. So we are doing a lot of work in community engagements. We're targeting different states and going in because we believe that you cannot go into a place with an idea or a plan for them. You have to go in and seek information ask people for their concerns, and then we come back and create a plan. So we're actively doing that work. So I ask you on all the social media platforms, please keep a lookout on the PAN Foundation. There you'll be able to see whenever we launch new, or we have an educational webinar, or all of the great work that we are doing here at the organization. And just in staying connected is like learning new ways about the program. Actually, I am in Dallas now, at a semi-conference, and one of the questions that I had come up to me is, how is it that so many people don't know about charitable assistance organizations, or why don't providers know about them? And I said, that is a great question. I go to conferences all the time, and we attend some of the same conferences, and people still do not know, one, about the organization, or two, just about charitable assistance organizations in general. And if the nurses don't know about it, the providers don't know about it, guess what? They're the first point of care for the patient, so the patients won't know about it. So it is very important to kind of like get this information out to patients. I'm thankful to be on this webinar with two other great organizations that are doing phenomenal work in this space. There is a lot of patients who need our help, and I am an advocate. I'm a patient advocate. I would do anything to spread the word about the work that we do. So thank you very much.
Alrighty, awesome. Thank you all. That was great.